well, a Friday morning staple. We are visiting with Janette Angulo, the Imperial County Public Health Department Director, and we're going to get updated information on the COVID-19 pandemic, how it's affecting the Imperial Valley, and maybe even ideas as to what you can do to start moving us in the right direction, Governor's Skittles scale of reopening the economy. First off, good morning, Janette.
Good morning, Carroll.
It's another beautiful day in the Imperial Valley.
It sure is.
Yeah, these are the kind of days that kind of make you forget August, right?
Yes, for sure.
Okay. As we have been tracking the dashboard numbers posted by the Imperial County Public Health Department, we see, well, a little bit of backsliding going in the valley. The numbers are not moving in the right direction. What's happening?
What's happening? So let's go over numbers and then let's look into a couple of things, a couple of factors that, may be playing into this. So let's start with testing. If you notice, if you're following our numbers, so we have over 73,000 tests. That's what our dashboard shows. And over the last few months, we've seen a total of 12,373 Imperial County residents testing positive. You'll also see that 95% of our cases have recovered. Currently, we have 341 active cases, and unfortunately, we've had 335 deaths. Now, to go into your question, Carol, what's happening? So let's take the last 4 weeks. By mid-September and for about 2 weeks, if you remember, we sustained a new daily case rate of 8, 9, cases, 1,000, and our testing positive ranged between 4 to 7%. Now, at the start of this month, we started to see that our numbers were increasing little by little. We went from an 11.03 new daily cases per day, and this is October, up to 14.98 daily cases as of now. Testing positivity too, we started with an 8.8% positivity rate at the start of this month, and it has slowly jumped to 10.12%. So a couple of factors that may play into this. Some of the restrictions are loosening. More and more people are out and about, at stores. Stores have reopened, gatherings, there was gathering guidance just released not too long ago. So more people are mixing, and it is to be expected. The more people mix, greater the opportunity to get COVID. So again, just different factors that play into the reasons why we're seeing increases. Okay.
And you mentioned the restrictions relaxed, and maybe you can explain that a little bit. Okay. I hope Tony is listening, because, Tony, I got another haircut. Some of the businesses have reopened, obviously with conditions, and again, as usual, more action.
Yes, there's more interaction. And let me tell you, businesses, when I've been out grocery shopping or, elsewhere, our local businesses are actually doing a pretty good job. And so it's the business owners, yes, but it's also the consumer. Also needs to take needed measures to make sure that they are safe, that their families are safe. So it's a 50-50, not just the businesses, it's also the consumer. We as consumers also need to do our part.
Okay, and one thing I have noticed, we have not really had an issue in the Valley of people, anti-maskers, if you will. I know there are people that, fit in that category, but it has not been a particularly big issue. And law enforcement's approach has been more of an educational approach than an enforcement approach.
Yes, and that's what we've seen too, Carroll. Face coverings, not a big issue in Imperial County. And let me tell you, I see some very creative people out there. They are in fashion with their face covers. So, they get creative, and that's great. And as far as enforcement, work closely with the cities, we work closely with our sheriff's men, and the goal is to community to try to, share that message and make sure that our community understands, the difference between the lower risk and higher risk activities. Again, all this to help protect, ourselves and those who are around us. So, yeah.
Okay. And as I've told people, I don't so much wear a mask for myself. I wear for you. And first off, you don't have to see my face. But second, if I should have something that you might catch, I'm protecting you. So we have to keep that in mind. Okay, we talked about some of the guidance has changed. Small gathering guidance. The state and then the county followed with, okay, you can get together small gatherings. How's that working?
Working. So this past weekend, the state issued guidance with social gatherings. And so in California now, gatherings of 3 households are now allowed. 3 separate households of in attendance, including the host. And you're right, our local health officer added an attendance limit of 16 people for all private gatherings. So here are a few points to remember if you do plan to gather. Remember that people from different household mix, that increases the risk of transmission of COVID. So the smaller the group, the better. Also, keep the households that you interact with stable over time. And, if you can, as much as you can, keep the gatherings short. Something key here is you should collect the names of all attendees and gather their contact information. In case someone from the group testing positive and contact tracing is needed later, the information is there. Also, remember that outdoor gatherings are much safer than indoor gatherings. And if you're sick or if you are in a higher risk, group, please avoid gatherings. Keep a safe distance from others, wash your hands, and wear a face cover. That's going to be very, very important. Ultimately, if you do gather with others, the key here is to engage in lower risk activities and take all the precautions to reduce the chances of getting COVID or transmitting it to others. So how is it working? I'm sure many families are glad to see this because, of course, we miss that interaction. But again, if we're going to gather, do it in a safe way.
Okay, now, Halloween, just around the corner. My wife especially and our pup are going to trick-or-treaters. What are the guidelines for Halloween and kids?
Yes, so yes, guidance was issued by the state earlier week. Pretty much, it's some of the concepts that, we talked about the gatherings, the gatherings guidance. But this Halloween guidance is a really good example for turn to celebrating Halloween. It pretty much talks about getting creative and doing activities in your home with your family, maybe doing some scavenger hunts, make it a movie night. If you do have to, you want to get outside, maybe do carb activities. But here's the key. Don't leave your car and mix with others while you're out. Now, in regards to trick-or-treating, the recommendation is that you should not go trick-or-treat or mix with others that are outside the 3 households, because again, the risk level increases. So look at it this way: the more people from different households And the closer the physical is and the longer the interaction, the risk level increases significantly. And when talking about trick-or-treating, it promotes congregating and mixing of many households, in particular, at the doorstep. So, try to avoid as much as you can those kinds of reasons, and you should not go trick-or-treating. Celebrate differently.
Okay. And one thing I have noticed, there are more yard decorations for Halloween this year than I've seen in a while. So that may give you an option, much like you ooh and ah as you drive around looking at Christmas decorations. Maybe you can pack the kids in the car and ooh and ah at the Halloween, or shriek at the Halloween decorations.
Yes, that's a great idea.
Okay, now I have another idea. OptumServe test site, Monday through Friday, 7 a.m. till 7 p.m. You can make an appointment. They are accepting walk-ins. Has the county ever considered a drive-through testing site where, kind of like you do with the flu shots for a brief period of time, so that we can get that number of people testing up? I realize at 73,000 people that have been tested, first off, there are some that have been tested more than once, but that's roughly 30% of the county population. And better, it's closer to 35 or 40%. But again, one of the things, though, that Dr. Monday has stressed, you have stressed, we have here at Kxo, is we need more negative test. So, is something like a drive-through option available?
So let's go to the OptumServe site. That site is ran by the state. So the public health department did assist with logistics, but it's actually ran by the state. Is the drive-through possible? Some of our local providers, at least one comes to mind, who has been doing drive-throughs. And we were actually talking earlier in the week what the possibility of having a drive-through was. So would it be possible? Sure. We just need to get the resources together and, talk about the logistics and figure out, a lot of these back-end, details. But yeah.
I know for flu shots, you've had drive-through clinics in effect, and maybe last 2 or 3 hours, and you're able to turn high numbers in a safely, in a safe manner. And I understand the logistics would be pretty intense, but that might pump up the negative numbers.
And it's also about making sure that we have an accurate picture of our community. So yes, the more testing we do, the better, we understand what's truly going on in our community. So a lot of reasons why, testing is the way to go.
Okay, now, one of the state added about 2 weeks ago was making sure that the underserved population is being served during the pandemic. And they put a whole set of metrics together for that. How are we doing in that area?
How are we doing in that area? Awesome question. We're actually in the orange tier. We're 2 tiers below. We are at a 4.6% when it comes to the health equity metric. And that metric takes, a look at the community, the county as a whole, and if there is an area where there's a higher positivity, we need to understand why that is happening, and we need to understand what kind of resources are needed in those areas. So, yes, we're trying to increase access and provide additional services as needed, but going back to that test, the health equity metric, we're doing pretty good. 4% in Imperial County this.
Okay. And that was just another curveball that the state threw. Do you see any other changes coming down?
Not immediately. Let's see what next week brings to us.
Yes. Okay, here are the rules. Oh, by the way, we changed the rules. It kind of makes it tough. Okay, we mentioned briefly flu shots. It is flu season, and the flu shots are highly recommended. The flu is not COVID-19. So what are we doing with flu shots?
Flu shots, yes, very important to get a flu vaccine. The vaccine is currently available, let me tell you, in many local pharmacies and with several medical providers. So if you haven't gotten your shot, please check in with them. Many of these providers are offering it at no cost, but check in with them for more details. Now, we do have 2 mass drive-through flu clinics coming up. One will be on November 3rd and the other one on November 7th, both Saturdays, from 7 a.m. to 10 at the Imperial Valley Fairgrounds. Now, this year, the vaccine will be administered at no cost for coping symptoms.
I was going to say, while you distract them putting the needle in the arm, swab the nose. Okay.
Oh, goodness. So anyone who has any symptoms, unfortunately, will be unable to receive the flu vaccine at the drive-through clinic. Just a few other notes: face coverings are required, and we highly encourage people to wear a short sleeve shirt because that'll make it so much easier for the getting and for the person administering it. So if you can, wear a short sleeve shirt. So those are the details for the upcoming flu drive-through vaccination clinic.
Okay. I think I've run out of questions, but I think we've covered pretty much what we need to cover this week. And now, next week, I know you're going to be busy, right?
Yes, very busy. Very busy. I'll be in and out of the office, but still connected. Carroll, can I just bring up something really quick? And it has to do with testing.
Okay.
And the community might find it interesting. We're seeing different types of diagnostic tests, that have been authorized for emergency use by the Food and Drug Administration. And so one of these is at-home collection diagnostic test. And some of you may have already heard about it or seen it advertised locally. So the at-home collection, this is what it is. It's a diagnostic test that's by prescription. The patient is allowed to collect the sample at home, and then she then sends it directly to the laboratory for analysis. And because this is a diagnostic test, and the laboratory in turn will report those results to the state and the local public health department. So again, just wanted to mention that because I've seen at least one provider locally that has some announcements out there already that they're offering the at-home COVID-19 test.
Okay, and we should tell you, the nasal swab, it is quick, it is not painful in the least, and it's obviously effective.
Yeah, yes.
Okay. Well, Janette, we visit, and we'll just keep to move along in the right direction.
That is right. If we come together, we practice all those prevention measures, we should move in the right direction. So thank you so much, Carroll, for having me.
Okay, you have a great weekend.
You too. Thank you.
It's like a trip through time. The Imperial Valley's best oldies on the radio. Don't you